Okay, so I'll let you guys have a minute to do that. That'd be great. So what we do is we share, I believe there's going to be 5 or 6 reviews between now and Sunday, which is awesome. Because we have more instructors this term, and all the instructors do 1 review per exam.
No, estoy en casa.
Hello? Oh, sorry. Okay, so all the instructors do 1 exam review per exam. So I think there are 5 or 6 scheduled for the next 4 or 5 days. So you can attend 1, you can attend all, however many you can. We also record them. And so when I finish with this class and I get the uploaded recording, I will send it to all the other instructors and they will post it in their sections. And then I do the same. So you should have 5 reviews and 5 recordings, right? Or opportunities for 5 live reviews and 5 recordings. Okay, so you should get all of them. And if you guys could turn on your cameras, that would be great. Kind of the same guidelines apply, whether we're in class or during reviews. So I do need your cameras on. I do expect this to be interactive. This is for you. So everybody has their own way of providing the information for exam 1. I like to go right from the study guide. Okay, so that's how I do reviews, is right from the study guide. So if you want to pull up your study guide or if you've printed it out, good place to take notes, good place to organize yourself for exam 1. Okay, so for those of you that are still coming in, please put your name and your professor in the chat so we can send that along for attendance. So really, really impressed with all of you guys here today. I've been doing this for 2 years now, and there is definitely a correlation of increased exam scores coming to live reviews. So thank you guys for all being here. So does anybody have any questions? Okay, so the study, I'm going to share my screen and pull up the study guide. Can everybody see that?
Yes.
Okay, great. So like I said, I like to do my reviews right from the study guide. We're not going to go through the entire 7 pages. I'm going to kind of give you an idea of how it's set up. And how some strategies for you guys for test taking. I know at least for my group, my 2 groups, I've provided several test taking tutorials that I feel are helpful for exams. They go through how to break out questions, how to maybe eliminate 1 or 2 answers right off the bat, how to pull out. The most important thing for exams is being able to pull out the key word or the key terms in the question. That's the most important thing. Okay, so what words, you guys are seniors now. What are we looking for in exam questions? What kind of words are we looking for? Or phrases?
The keyword. Keywords.
Like what? What are some keywords? You can say them out or you can put them in the chat.
Like first,
Most, best, priority.
First, last, greatest, most important. So that's number 1. Okay. When I do exam reviews with students after exams, that is the most common error that I find, is you haven't pulled out you haven't identified a keyword or key phrase if it's a priority question. And that's why I always suggest you read a question, read the question at least 1 or 2 times. Okay, you may have missed it the first time around. And then you have, remember for exams, for starting this term, it kind of was transitioned from last term, this term. Instead of a paper and a pencil, right, you guys need a whiteboard, right? Everybody knows that? You need a whiteboard with a marker. So I suggest after you read a question, if you find a word or a phrase, write it down on your whiteboard. So that when you read it a second time, make sure there's nothing else that stands out. So that's one of my tips for pulling out important words and phrases. The other thing that these exams do is they'll ask questions, let's say in the negative way. What I mean by that is in discussing, here's an example, in discussing and mentoring a new nurse, you hear her communicating with the patient about discharge teaching. What might she say that would require further education? Why is that a negative question? Because you're looking for the wrong answer, right? What does she say that's concerning? Right? So be careful of those questions. There's several of those questions in there that ask it from the negative way. All right. You're teaching a mother, you're teaching about a mother about the risks of smoking in the house on her children. What does the mother say that would require further education? So what are you looking for? Something she says that's wrong. Okay, that's another really common mistake that I review with my students after exams. All right, you got to be able to recognize if it's being asked in the negative way. Make sense? Another rule of thumb, read the question a couple of times, 2 times. If you're still clueless and you don't know the answer, just make an educated guess and move on. Okay, do not keep reading the question. Okay, 3, 4, 5, 6, 7 times. Okay, you're going to know after the second, maybe third time that you just don't know the answer. That's okay. It's one question. Okay, the more you try and figure it out, your frustration level is going to increase, your confidence level is going to decrease. Okay, so give it a shot. And then if you can't come up with an answer, just pick the best answer you think and move on. Okay. What else? Anybody else have any test taking strategies that you'd like to share with the group? It's a pretty big group. What else do you guys do?
Yes, I usually, oh, sorry.
Go ahead. Helen?
So I usually first look at the answers, the choices. First, I will read the answers and then question. That's how it works for me.
Okay. Helen?
Yeah, I never choose the answer that contains only or,
Never.
that phrases are never, only.
The absolutes.
The absolutes. That's a good one. Yep, that's a good one.
And the umbrella. I'm sorry, Professor.
No, go ahead.
And the umbrella. The umbrella answers, all apply to the umbrella.
And don't forget, if you have a select all that apply question, do not be afraid to select all. Okay, don't sit there and say, well, no, they wouldn't ask me a question that everything applies. One's got to be wrong. No, that's not necessarily true. There may be several questions of your select all that applies that everything applies. So do not be afraid to select all that apply. And then here's another strategy that I like to encourage students to do. Read the question and then don't look at the answers. Look away or cover them with a sticky or whatever you want to do. Read the question and then try and come up with an answer in your head of what the right answer might be. Right? And then go back and read the question, the answers, and see if something matches. It's probably spot on that that's the right answer. If you're able to answer it in your own head and then go find that answer and it's there, it's probably the right answer. Does that help? So these are just some strategies that I review with students all the time. Be mindful of your time. You have plenty of time to take the exam. I hate to see students when they're finished in 30 minutes, 25 minutes, 30 minutes. I mean, either that's a good indication that you absolutely know everything and you just kind of blew through the exam, or you just didn't study and you just had to get through it and you didn't know the answers. I typically find that the less time you're taking, the lower the scores are. So take your time. You have 75 minutes. Take your time. Okay. But be mindful of your time. Sometimes questions will take a little bit longer to read. It's a long question, it's long answers. Yeah, those are going to take a little more time, but be mindful. Don't get caught up at the end, having to rush through the last 6 or 7 questions and you just have to pick something. Okay. So those are my off the top of my head strategies. Anybody else have anything to contribute to a strategy they use that is successful? Okay. Okay. So this exam next week, same kind of guidelines apply. You're going to be taking your exam during your lecture. Whether your instructor brings you back after, I have no idea. I don't bring my students back. I think they've had enough. So we'll be covering, this is just weeks 1 and 2. Okay. Chapters 1, 2, and 3 and 9 were covered in week 1. And then 20, 21, 22, 23, and 31 were covered this week. Okay. Number of questions, 50. Multiple choice, select all that apply. There are a couple of true false questions in this exam, which is new. And then some math problems. You get 75 minutes. As far as math, I would review some IV calculations, determining equivalence, converting between the systems, oral and parenteral medication, and doses for kids. I have sent out, at least to my group, 3 or 4 good math resources. One is a kind of a 4-hour review that Dean Brown did a couple of terms ago with students. It's in a YouTube video, and I always send that out every term. And then I send out a couple of little cheat sheets for good, easy, how to set up your formula, how to do your calculations, just real easy. If your instructors haven't posted that for you, ask them for it. Okay, my groups have all the test taking tutorials and they have all the math resources that I can provide to them. So if you struggle with math, open up some of those math resources. And Dean Brown's tutorial is excellent. I mean, it's long, but you don't have to look at it all at the same time or go to the sections that you need some help on. Okay. Review the, well, here it is, review the math handouts and do practice questions that were posted in the announcements. Okay, so if you don't have the math handouts, get them from your instructor. Case study applications of concepts, assessment and prioritization, management of care. Okay, community is all about ADPI as well. You use the nursing process in community, it just looks different. Doing an assessment in the hospital is a lot different than doing an assessment in the community. Remember, in the community, who's your client? Can be an individual, can be a group of individuals, excuse me, can be a family, can be a subset of the community population, diabetic, the elderly, the homeless, the kids. Okay, so we are using nursing process all the way through every area of nursing we work in, including the community. So one of the things you need to be able to do in this class is to transition your ADPI into the community. Okay. Always remember safety first. What is the priority? And then the other thing that you've been introduced to is the levels of prevention. We need to know the levels of prevention, what's primary, what's secondary, what's tertiary, as it relates to each chapter. Okay, and I know you know about primary, secondary, and tertiary, but we now have to apply that into the community setting. Okay. And we'll go through that in the study guide. Healthy People 2030 is a big part of the exams in this term as well. You have a link to that in your week 1 activities. So you need to understand the objectives. What are the main objectives of Healthy People 2030? Okay, I don't want you to go in and review Healthy People 2030 for every single chapter, but I want you to have an understanding of the main objectives of 2030. How is it different than 2020? And then certainly for this class, we need to understand the difference between community-based and community-oriented nursing, and we'll go through that. Okay, this is not an all-inclusive study guide. However, this is a really good study guide. Okay, it's not all inclusive, but we have spent a lot of time putting this study guide together. It comes from your readings, your PowerPoints, your they come with review the exam. And so this is a really, really good starting point for studying. Okay, if there's things in here you don't understand, you need to go back to that reading to get a better understanding of it. Okay, and what I tell my students is if after attending reviews, watching recordings, reviewing the study guide, you still have areas that you don't understand, set up a time this weekend or next week before you take the exam and meet with your instructor and go over what you don't understand. Okay, I'm happy to do tutoring with students, but I need you to, before exams, but I need you to do your part too, which is everything is to prepare for studying, prepare for the exam. And then what you don't understand, we can go over. Does that make sense? And I would use your study guide. I mean, really, it should have notes all over it. Right? You know, maybe highlight the sections that you get, makes sense, and maybe highlight in a different color sections that you, I don't really remember a lot of this, that she really didn't cover that in class very well. Because of course, I'm not going to be able to cover, we are not going to be able to cover everything. Right? So highlight any parts of your study guide that you don't understand. You have to go back and do some research. You have to go back and do some reading about what it means. Okay, best practice to prepare for the unit exam is to review your notes, review your recordings. You know, if you were if you were in lecture and participated and took notes, great. But if you missed part of lecture or you missed all of lecture and you missed 5 or 10 minutes because you had to do something, go back and review that section. Okay, readings, projects, your discussion question. From this week, the common childhood ailments, that plays right into the exam as well. So that's our cover page. So this is broken out into sections. Okay, each of the sections is a concept. This study guide is full of concepts. Okay, these aren't the questions on the exam. Okay, they're not. These are identifying the concepts that are going to be covered on the exam. So what I would encourage you to do is, let's just take the first one. Risk factors for SIDS include, what are they? Prone or side-lying position, sleeping on a soft surface, maternal smoking during pregnancy, overheating, late or no prenatal care. Okay, and on. So these are the risk factors. What question, now think about, they're giving me the risk factors for SIDS. What kind of question might be asked? Got to look at the information that's provided on here. What kind of question might be asked?
Select other side.
Maybe it's a select all that apply that said, pick all the risk factors for SIDS. Or maybe pick the one risk factor, pick the one that is not a risk factor. That's how I want you to think about when you go through each of these bullet points. Okay, here's the information they're giving me. What do they want me to know? Okay, and definitely look at the topic, priority and safety assessment, key concepts to using ADPI, safety, and delegation principles. Okay, so let's look at the third bullet. Review 2030, that means Healthy People 2030, principles on safety for adolescents. That's pretty specific. Right? Review the principles of safety for the specific adolescent group. Okay, it's gonna, obviously it's gonna incorporate violence, motor vehicle, safety, right? Remember, these are the leading causes of morbidity and mortality for adolescents. Right? So there's very important information. Right? These are the leading causes of morbidity and mortality. What might the question be? What are the two principle review? What are the two 2030 principles from Healthy People 2030? What are the two leading causes of morbidity and mortality? What are they? It's right here. What's the answer? Violence and motor vehicle. motor vehicle accidents. Are you following along with me how I'm trying to look at this?
Yes.
Okay.
Yes,
Let's look at the next one. Safety assessments. Know what environmental things you should look for when assessing common areas of playgrounds. So that tells me, or if I'm reading this, that tells me I need to be familiar with playground safety. So if you don't know where to find that, you're going to have to go back to your readings. I don't remember what chapter it's in, but there's a whole area about playground safety. And it says, what would put a child at risk? Okay, what are the safety recommendations? So maybe you're going to get a question about, you've been asked to, I'm just making this up, you've been asked to sit on a team that gives recommendations for a new playground. Here are the things that are going to be put in place. What's good and what's not good. Meaning what is taking safety into account and what would put a child at risk. So you need to know there's a box in that chapter that talks about playground safety. Okay. And again, I'm not going to go through all these bullets. I'm just trying to show you how to analyze each of them. Okay. Review concepts regarding assessment and how health disparities play a role in ADPI and health prognosis. Okay. So the key word here is health disparities. I like to highlight. So key word in this one is health disparities. So we need to know, you need to know, how do health disparities play a role in ADPI? So you would go back to the chapter, I think that was in family health risks. I'll tell you the two big chapters are 21 and 22. Okay, 21 is family health risks, 22 is health risks across the lifespan. Those are two big chapters that are covered quite a bit on this exam. Okay. Let's do this one. Understand the difference between primary, secondary, and tertiary levels of prevention. Be able to distinguish between them and know the given examples of each. So let's do that. What are these levels? What have you learned about primary, secondary, and tertiary? What's primary? I do the.
It's education.
Well, be careful on that. So let me give my spiel on that. I do primary, P primary equals P prevention. S secondary equals S screening. T tertiary, I put T as testing. No, treatment, sorry, treatment. Okay. Be careful about education because education is at all three levels. Okay. You're going to be educating in the primary level for prevention because that's what primary is. We're trying to prevent something before it happens, right? Secondary, I like to say, is early identification, early treatment. Okay, so you're screening for risks. You're trying to early identify, early treat. And there's education there as well. Let's say you're working with a group of high school students that you've identified that are at risk for obesity. Okay, they're not obese yet, but they're at risk. You're going to be doing education with them as well, right? On the dangers of obesity, long-term health effects. So and then tertiary, right? The event has already happened. They either have a diagnosis, a condition, they have something. So now you're trying to help them manage it, treatment, manage it. So you've already had a stroke. So how do you help them manage the stroke? Well, education is at that level too, right? So be careful. Don't get caught up on primary education. Okay, it's at all three levels in all three different ways. So just think about primary is prevention, secondary is screening. So you're screening at risk for risk. And tertiary, they already have the event has happened, the diagnosis has happened, the condition has happened. Now you're working with them to manage it. Okay. So let's give an example of each based on what I just told you. What's an example of primary?
Immunizations.
Yep. Because what are you trying to do? Prevent. What's an example of secondary?
Mammography.
A what?
Test.
A mammography.
Say that one more time.
Mammogram, she's saying.
Mammograms.
Mammogram,
Yep.
X-rays,
Yep. Yep.
CT
Screening.
scans.
Yep.
Colonoscopy,
What else?
colonoscopy also, Professor?
Yeah, yeah.
All right.
And what about tertiary? That's an example of tertiary.
Rehab,
Teaching a group of elderly clients how to manage their diabetes. Why is that tertiary? They already have diabetes. Teaching, working in a group home, teaching impacted patient. They're working in a group home, teaching clients with mental health diagnoses, coping mechanisms. Why is that tertiary? They already have a mental health diagnosis. Okay. Please, there's a box right in this chapter when you're preparing for a home visit. What are safety precautions? Okay, obtaining an escort when walking back to your car. Review home visiting safety tips. So that's crystal clear. Go back to that chapter and look at the box and what are your safety tips? They include making sure a lot of students get caught up on making sure they don't understand why you have to sit between the client and the exit. Why is that a safety tip? Because you need to be able to get out.
If they have a psychotic episode, you can
Exactly.
leave.
Exactly. Okay. Know the definitions of a family. Okay, look at the function of the family. Okay, what are the definitions of a family? So again, going through this, if you can't answer these questions, highlight it because you have to go back and get that information. What's the nurse's role in health risk reduction? It's right from your reading. The next section is acts and organizations that play a role in public health. Here are the ones you need to know for the exam. What's FMLA? And how does it affect communities? Do you know what FMLA is? Family Medical Leave Act. Okay.
It prevents your job. It prevents if you have an
Mhm.
emergency, you need to be out
Yep.
of work for you not to be touched.
Mhm. Understand the benefits of Medicare and Medicaid. Do you know the differences? Key differences, Medicaid is for it's income-based, right? No age limit, income-based. Medicare, what are the two qualifications for Medicare? 65 and,
Disability,
go ahead.
disability and retirement age.
Yep. And don't forget that one, Esther, that's good. That's good that you know that, because everybody thinks of Medicare as just age related, 65 and older. It's disability.
If you spend a year on straight Medicaid,
Mhm.
disabled, you're eligible to, I'm sorry, if you spend a whole year straight on Medicaid due to disability, you're eligible to apply for Medicare. And if you don't apply within that time frame that Medicare provides you, you're locked until you retire.
Mhm. Yeah, excellent. Yep. Know the principles of the Affordable Care Act. What was the Affordable Care Act and what was its purposes? Okay, I'm just picking out a few of these and reading it, reviewing it with you. Know what Frontier Nursing Services primary focus was. Here's your answer, vaccinations. Okay, Frontier Nursing Services did a lot, but their primary focus was vaccinations. Okay, so we need to know this. What's a definition exam? What's the difference between community-based nursing and community-oriented nursing? Can anybody articulate that? And if you can't, we need to go back and look. You need to go back and review, but let me give you my quick synopsis. I think of community-oriented nursing as the big picture. You're orienting yourself to the community. You're looking at how is the community made up? You're looking at what are the risks? What's the population? What are the demographics? You're looking at the big picture. Okay, so you're orienting yourself to the community. Community-based, on the other hand, the way I remember it is you're based in the community. So you're in the community taking care of clients that are ill. You're doing your home health, you're the hospice nurse, you're the home health nurse. Does that make sense? So you're either oriented or based. Oriented is the big picture. You're trying to get a feel for what's going on in this community. And then based is you're based in the community working with the ill population. Okay. What is the purpose of Healthy People 2030? How is it different from Healthy People 2020? Here's your two answers right here. Focuses on health equity and social determinants of health. Sets national goals and measurable objectives to guide evidence-based policies and programs. Okay. And then QSIN. What's QSIN? Have you guys stumbled upon your QSIN boxes in your chapters? There's a QSIN, it's quality and safety education for nurses. They're considered competencies. Quality safety education for nurses competencies. Okay, it should be in, I think, chapter 1. There's a box that introduces QSIN. What is QSIN? Okay, these are, I think there's 6 of them, 5 or 6 of them, 6 competencies that they take through the whole book. Okay, they take each chapter and apply one of the competencies, whichever is applicable, to each chapter. So that it's identified in each chapter. Which competency are they focusing on for that particular chapter and its content? And you will get a question about QSIN on the exam. Just telling you that. So I want you to know what that is. I want you to know what the 6 competencies are. 5 competencies. Okay, because think about it. Our whole nursing practice is we have to be competent, right? We have to be competent caregivers. So QSIN, Quality and Safety Education for Nurses, has identified these competencies, and we must follow them all the way through. And as you're going through each chapter, you'll see which competency they chose to showcase, if you will, for that chapter. Okay. And then understand healthcare system, how it's divided. So our healthcare system is divided in 2 ways. Primary care, private care, public health. So private, non-private. Did you guys know that the US spends, well, what is the cost of healthcare in the US? Do you guys know that the US spends more on healthcare than any other nation? Have you stumbled upon that statistic? Okay, here's, there are also definitions on the exam. Definitions meaning knowing what, we're in the section of organizations that play a role in public health. Well, here's a couple of really important ones. CDC, okay, and it tells you what it does. It focuses on protecting the public through research and education. And CDC, this is important, provides the most current guidelines for public health nursing. Think about the last 2.5 years in the pandemic. Who has been directing our care for the pandemic? CDC, okay? The next one you need to know is the WHO. What's the WHO? World Health Organization. Okay, what do? Simple. They support global health. It's right here in this paragraph. NCHS, next one, focuses on data collection related to population demographics. And then the 4th one is Institute of Medicine. And it tells you what that focuses on. So you may get a question that says, which agency focuses on data collection related to population demographics? Well, the right answer would be the NCHS. Which agency focuses on the most current guidelines for public health nursing? So as you read these bullets, again, I've said it a few times, think about what do I need to know? What are they going to ask me? Okay. Know this. What's the difference between advocacy and social injustice? You guys know that? If you don't, we need to know that. Anybody know the difference? What's advocacy? As a nurse, we're advocates all the time. What's advocacy?
Like defending the rights of the patient.
Mm-hmm. What else? There's many different ways to describe advocacy.
Maybe to treat everybody the same, every patient the same.
Here's your 2 answers right here on the next page. Advocacy refers to the actions taken on behalf of another, right? Nurses in the community setting, we are always acting as advocates for our vulnerable populations. Okay. And then what's social justice? This up here should say advocacy and social justice. Okay. So social justice, but treatment, equal treatment. The heart of social justice is justice with respect to the treatment of the more advantaged versus the less advantaged socioeconomic groups, right? What's the primary goal of public health? Here, the prevention of disease and disability. Okay, our whole goal as community nurses is trying to keep the community as healthy as possible. Okay. Population of the world is increasing due to increased fertility rates and decreased mortality rates. That tells me that, what about a question like, what are the 2 reasons that the population of the world is increasing? There's many reasons, but according to our book, we have 2 main reasons the population of the world is increasing. There's only 2 answers: fertility rates, increased fertility rates, and decreased mortality rates. Okay, people are definitely living longer due to advances in healthcare, vaccinations, screening tools. Next section, management of care across the lifespan. Okay, this is important right here. We're going to talk about this a lot during our term. Okay, about unless the patient is, your patient in the community is declared incompetent, the patient should have the right to participate in their own care. Right? This is about ethics. Okay. We call it self-determination. Okay. Patients should have the right to they should be able to self-determine what their plan of care is. Okay. And so how can we help them do that? Here are some goals. Maximizing self-care capacity, number 1. Managing chronic diseases effectively, 2. This is how we help them. If they are competent, how can we help them remain competent? We can, by these goals right here, helping them maintain self-care, managing chronic diseases, preventing complications, number 3, delaying deterioration and decline, number 4, and then achieving the highest possible quality of life before dying with comfort, peace, and dignity. So we talk a lot about the patient's right to self-determination throughout this term. And here are the 5 goals and how we work towards maximizing that for the patient. Okay, and again, what's primary, secondary, tertiary? Provide an example. What's a durable power of attorney? What's a DNR? Okay. And then we go into school nursing that was covered this week. This is what we need to know about school nursing. It tells you right here, definitely go to your school nursing chapter and review the Healthy People 2030 objective for school nursing. It asks you to review the duties of a school nurse, such as vaccinations, how to teach primary, secondary, tertiary. Okay. Talks about a few ailments to know about: conjunctivitis, lice, obesity, and then think ADPI. Again, you got to think your ADPI. Your assessment of a pediatric patient in the hospital is going to look very different than your assessment of a student who comes into a health clinic. Okay. Which ailments, if presented with various ones the child could present with, would take priority. So you may get a question, if we're in the school nursing section, of several students present to the clinic. This one has this one has this, that one has that. Which student is the priority to see? They're all going to get seen, but or who remember your ABCs? Is there anybody having issues with breathing? Okay, so you have to be able to prioritize of a group of students that come in the clinic who's priority to see. And then here, how to manage conjunctivitis. Okay, you got to know about conjunctivitis, hand washing, warm compresses. Okay. So, family assessments, home visits, interventions. Again, you can go through these and see what you know and what you need to do some reading on. Vulnerable populations, evidence-based practice. I think that was chapter 3, evidence-based practice. This is important. Evidence-based practice. Our whole nursing profession is, we work with evidence-based practice all the time. Okay. And does anybody know what evidence-based practice is? Okay, so evidence-based practice is always using the most up-to-date research, testing on whatever kind of nursing you're working within, right? It definitely represents a cultural change in practice. Does anybody work with anybody right now that always says, we've been doing it like this for 30 years. It's fine. We'll just keep going this way. Anybody work with anybody like that? Okay. That's the big shift. The big first step in implementing evidence-based practice is recognizing your own practice and believing that the care is based on the best evidence to improve outcomes. What that means is, let's say you're working on a stroke unit, and based on new evidence, you've come up with ways to get the patient out of bed, or research suggests and peer reviews suggest that there are ways to get the patient up sooner, safely. So let's say you're presented with that from your medical team. That's evidence-based practice. We have new ways to treat this patient. You should be able to be on board with that and practice the most up-to-date information, strategies, skills that are available to us. Does that make sense? That's evidence-based practice. Okay, evidence-based practice includes research, knowledge from science, clinical, expert opinions, clinical trials. Okay. And then the last one under here is, what is the purpose of the Nurse Practice Act? We need to know that. So, with all that said, does this give you an understanding of how to approach studying for the exam?
Yes, ma'am.
And again, if you haven't had class yet this week, a lot of this will be covered in class this week because it's week 2 information. But I promise you, if you have a good understanding, not memorization, but if you have a good understanding of the study guide, you will do absolutely fine on the exam. Okay? You just have to have a good understanding, and you have to be honest with yourself on what you have confidence on that you understand, because remember, the study guide is it's a bunch of concepts. Do you understand the concept, or do you have to go back? If you haven't done any reading for the last couple of weeks, you're going to have to go back and do the reading. Not all of it. You go back to the specific bullets that are on the study guide. Nobody's asking you to read how many chapters? 1, 2, 3, 4, 5, 9 chapters. Nobody's asking you to read 9 or 10 chapters cover to cover. But we're asking you to pull out the important parts of each chapter based on the study guide. So the study guide is a summary. Does that make sense? And as I tell my class, don't try your best to prepare adequately for this exam. It really stinks when students don't do good on the first exam, because it puts additional stress on you. And I know this is a really heavy term, right? With peds and med-surg too, I get it. But if you start falling behind in this class, it's just an additional stressor you don't need. And the fact that you're here today is a fantastic sign. But yeah, that's my words of wisdom is just do what you can to prepare for this exam, do fine on it. And like I told my group last week, this is a class, just keep up with it. This isn't a hard class. It's really not. And there's a reason why you have it in week at the end when you're seniors, because this class is pulling everything together, right? It's pulling your Jerry, your peds, your maternity, your fundamentals, your med-surg. This is why this class is at the end of your program, because it's pulling everything together. Because in community health, we have to pull all those knowledge bases together, right? Because in community health, you may be taking care of clients through the whole lifespan, whether it's infants all the way up to the elderly. So this is the class that you pull all your tools in your toolbox out. And that's why you'll see that some of these questions, or a good part of these questions, have some med-surg focus. They have a pediatric focus. So, but no, this isn't a hard class. It really isn't. Just prepare adequately, take the exam, do well, and then get going to med-surg and peds. Okay, I don't want you to fall behind. It's too stressful, because we only have 3 exams and then your HESI. That's your only KGA. So if you don't do well in the first exam, your next shot to up your grade is not till week 6. So, and I don't want you stressing about it the first 6 weeks. Okay, I'm just being honest. I've done this before. So just take the adequate time you need to prepare for this. Don't shortchange yourself and not study. But I'm glad you're here. I'm glad you're here. This has been recorded. I'll send this out to all your instructors. Again, if you don't have the math and test taking tutorials, ask for them. But I gave you my main strategies that I go over with students all the time.
Thank you.
Does anybody have any questions? Has this been helpful?
Yes, ma'am, it has.
Okay, all right. And did everybody get their names and professors in the chat?
Yes.
So I can send that along. Okay. Well, I wish everybody really good luck on exam 1. Again, the study guide is an excellent start. Use that as your center point, and then reach back out to your book, your PowerPoints, your notes, and fill in the blanks.
Thank you.
And you'll be fine. I promise. Okay.
Thank you, Professor.
All right. I'll stay on if
you.
anybody
Thank
has any
you.
questions. I'll stay on if anybody has any questions.
Thank you. Have a good
You're
day.
welcome.
Thank you. Bye.
You're very welcome. Bye.